Hello. I would like to talk to you about narcolepsy. Narcolepsy is a sleep disorder that makes people very drowsy throughout the day. For example, um, there are two types of narcolepsies that I have listed: the cataplexic and non-cataplexic. Cataplexic is provided with symptoms of muscle loss, um, in your muscle tone. You can't control it. You are tired after any form of excessive activity. If you're laughing too hard, if you're overly angry, your emotions take a play. There is sleep paralysis where you can't move in your sleep. There is hallucinations where you see or hear something that isn't there. And then there's rapid change in your REM sleep, which leads us to the sleep patterns. A normal person's sleep, you will start with the non-rapid eye movement, also known as NREM, N-R-E-M, but where your brain waves will slow. But then you'll go into REM sleep where you have rapid eye movements, you're going into your dream state. But for narcoleptic sleep patterns, you go straight into REM, where you go straight into the dreams. You don't have a slow step. You just pretty much drop right into it. Some causes of narcolepsy is people with type 1 narcolepsy, cataplexia, is effective of low levels of hypocurine, also known as orexin, which is a chemical in the brain saying it's time to be awake versus it's time to be asleep. If you have low levels of it, you're going to go to sleep. Then we have the less likely risk of it being genetic. If you have a family member who is closely related to you who has it, there is a 20 to 40% chance, higher time, of you probably having it. So, mom, dad, maybe your aunt, you might want to get tested. But it is about a 1% to 2% chance of it actually happening, as it is one of the more rarer sites. The CDC says even if you have 7 to 8 hours of sleep, you're still going to be tired throughout the whole day. It's something out of your control, as stated before. We also hear from Mayo Clinic, which talks deeper into the diagnosis and risk factors. It is a risk factor from ages 10 to 30 years of age, though it is not limited to that. It is also the one who explains more on the family history, stating that narcolepsy is 20 to 40 times higher if you have a close member of the family who has it. Some complications: it may affect a person's view on you. They'll see you as lazier. That it may affect the relationships you have. So it's always best to talk to your family, as it is hard on you and them, as there's not much a person can do for narcolepsy except go to a doctor and see what's best for them. And then there is also the effects for obesity. If you have narcolepsy, there is a chance of having higher risk for obesity. Diagnosis and treatment: go to the doctor if you have any of the symptoms listed before, and they will help you find a better schedule as what type of medications you might need, as there are some medicine, both over the counter and not, that you may need insurance for. But they can also find the best diet, the best schedule for you as a person. I hope this is helpful. I will be providing these posters with minimal information, but it covers the main points of this poster. I hope everyone has a wonderful day.